Hey everyone, thanks for coming back to the BNS channel. My name is Edie and it is Tarlov Cyst disease update time. So back in October of 2024, I had Tarlov Cyst surgery. About 2 years prior to that, actually in 2021 is the first time they saw any Tarlov cysts on my scans, and I had an MRI done. Most doctors feel that Tarlov cysts are non-symptomatic, that they do not cause problems, and they basically just say that they just kind of ignore them, really. They were mentioned on the radiology report, but my doctor never mentioned them. Matter of fact, I think I might have looked it up on Google to see what they were, and even Dr. Google was not very informed as to what they are. And the reason is because they are a rare disease, and only 20% of Tarlov cysts are symptomatic. And I'm part of that 20%. They can be pretty problematic when they are symptomatic, because they can cause, depending on where they are and how many you have and how big they are, they can cause problems that are mistaken for other things. Back in 21, when I had the MRI done, they were saying that I needed to have a hip replacement at some point, because the pain that I was feeling was in my hip area, and they just assumed that the problems I was having were going to be arthritic. They were going to be erosion, bone erosion in my hip area, which I do have some of that, but the pain that I was having, now I know this, was not associated with that at all. So I started having really severe lower back pain in 2023. The end of 2023, and it came on with a vengeance, and then it kind of went away for a little bit, and then it came back again early 2024, and ended up having another MRI done, and those Tarlov cysts were still there. They were reported again, but this time I did a little bit more digging and did some research of my own. And thanks to two people, one, my chiropractor, which was brand new. I had never seen him before. He's the one that ordered the MRI. So thanks to him for that. And two, I had I think she's a physician's assistant, or she might have been an LPN, or an LRN. I don't know, but her specialist at the time was in orthopedics. She just happened to be doing a per diem in my family practice that day, and I ended up seeing her, and she's the one that said, "You really kind of want to look into these Tarlov cysts a little bit more," which sent me home looking and digging deep. And that's when I found out that Tarlov cyst disease is a rare disease, and that there are only 2 surgeons in the world that do a specific type of surgery to help the ailments of these cysts. Now, they are not typical cysts. They are fluid-filled sacs, but they are off the nerves of your spinal cord. And so you can't just cut them off because you're cutting your nerve, and that would be no bueno, right? And so there's a special technique that they use, especially Dr. Feigenbaum, who is in Texas. He is the originator of this procedure, where they drain the cyst area and then they wrap it so that they do not re-expand. And the way that I like to explain this so that people understand is, I want you to envision a water hose, and when there's a weak spot in the water hose, it bulges, right? If you were to cut that off, the water hose is it's not going to be good anymore, right? You can't use it anymore. And so that's the same concept. So basically what has to happen is you have to drain it so that it'll shrink, and then wrap it so that it will not re-expand. And so that's basically what Dr. Feigenbaum does There is Dr. Schrott in California that also does the same type of procedure with I think it's a little bit different. And I'm not 100% sure. I didn't see him. I went to see Dr. Feigenbaum, and we did surgery in October of 2024. I'm going to tell you that right now I am pain-free from the pain that I was having prior to this surgery. Now, I do still have hip pain, and so that's why, and it's right in the inner groin, the fold of your hip area, and so I know that there is still some hip issues that will have to be addressed at some point. But the radiating pain that I used to have in my hip, the sciatica nerve problem, the back pain, I used to have really severe back pain in like the dimple area of my back, and that's all gone. It's all gone. So now I'm 6, 7, 8, 9 months out, and I'm much, much, much better. My mobility is back. I'm not in bed all the time. I still have a little bit now. Keep in mind, and sorry for the bumpiness, keep in mind that they say it's a 3-month to 2-year recovery. And so I'm still in that 2 years, right? And so there's times that I have to slow down or stop because I start getting sore, more so than pain. But other than that, I would say that it's a success. Now, the one thing that we have to understand is this does not cure the disease. I may get other cysts. I may have other cysts that are asymptomatic, meaning there are no symptoms involved with them. I could develop more cysts in the same sacral area that I had, and it could cause pain again. So I have to be mindful of that. I have to be careful, and I have to not overdo it. So I had 5 Tarlov cysts that were repaired or fixed or whatever, from S1 through S3, and they were bilateral, meaning that they were on either side of my spine. And being in the sacral area, they're all kind of conjoined all together at the bottom, and it made it very, very painful. I think I'm one of the lucky ones. There are people that have this surgery that don't get relief, and that makes me very, very sad. So I just wanted to give you guys a quick update, let you know where I'm at. As of right now, I'm doing well. If you have any questions about the surgery, any questions about Tarlov Cyst disease, or TCD as we call it, please let me know. I do know that this disease is, what do they call it? It's progressive. So it doesn't get any better. It gets worse. And that's the reason that I chose to have surgery. It doesn't go away either. It's not a cure. It can fix the ones that you have. It could help with symptoms. It's not a cure. So I will have Tarlov cyst disease for the rest of my life, and hopefully will not have any symptoms from any that I still have or might get in the future. So, all right. Have an amazing day, everyone, and I will talk to y'all soon. Bye.